Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Doctor Education. Welcome back to another video on my channel. As you know, I make videos about health and healthcare topics, and all my videos are directly referenced from internationally accepted US National Medical Library, so you can trust the information given in my videos. So today, with all your requests, I'm making videos on dandruff or seborrheic dermatitis. Today we're going to discuss everything there is to know about this problem, and I'm going to give you all the solutions there are, so don't miss the last part. Stay tuned.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
So guys, your scalp is basically the skin which is there in your head, and it can have a lot of problems. Dandruff is basically flaking of the skin. The flakes can be yellow, they can be white. The dandruff can actually make your scalp itchy also. So this can happen in any age. It can start in puberty. It's very common in men, and that's also called as seborrheic dermatitis or seborrhea. That's basically a skin inflammation. It's basically a condition that can also cause redness and irritation in the skin, and most of the time using a dandruff shampoo can actually control the dandruff. But if that does not help, you need to go to a doctor. You need to go to a dermatologist. That's the thing. And there is another type of this problem, dandruff in babies, seborrheic dermatitis in babies, that is called cradle cap. Cradle cap is basically which lasts for a few months and then goes away on its own, right? Besides the scalp, it can actually affect other parts of the body also, like eyelids, armpits, groins and ears of the baby. So normally washing the baby's hairs every day with a mild shampoo and gentle rubbing on the scalp with your fingers or a soft brush can help. And for severe cases, only for severe cases, you need to go to a doctor. They will give you a prescription of a shampoo and a cream to use, right? So that's the basic thing about cradle cap. Now let's talk about seborrheic dermatitis. Why does that happen? What causes seborrheic dermatitis? There can be because of a combination of factors. First is your oil gland activity. Right? If somebody says, okay, this is the problem, they are wrong, because it's actually not dependent. Sometimes oil gland activity can be high and still you might not have dermatitis, right? This seborrheic dermatitis. So there is one factor. This is just a factor, oil gland activity. Then yeast. There can be malassias that live on your skin actually, mainly in the areas with more oil glands. They can actually cause this infection. Then sometimes your genes, genetics are involved, and changes in your skin barrier function can be there. So these are basically proposed the factors, and there can be a lot of risk factors including stress, fatigue, extreme weather condition, oily skin, of course, skin problems like acne, heavy alcohol use, a lot of lotions if you're using which contain alcohol, obesity, if you're overweight, nervous system disorders, like sometimes if you have like stroke, Parkinson's disease, you might have this, and even some infections like HIV/AIDS. So all these things can actually promote your increase your risk of having seborrheic dermatitis. If you do have that, obviously this problem can happen anywhere in the body, but when it happens on your head, that is called dandruff. It often forms where the skin is oily and greasy. That's the basic, and it can actually include many areas, including the eyelids, eyebrows, creases of the nose, sometimes the lips, behind the ears, outer ear, middle of the chest also can be involved. Obviously dandruff is there on the head. In general, if you have this problem, your skin will be scaly. There will be flakes over the large areas. There will be greasy, oily areas in the skin, and the skin scale will be white and flaking, sometimes yellow, sometimes oily. It might be a sticky dandruff. Itching can be there, and there might be hair loss. There might be mild redness. These all things can be there. Then how do you diagnose it? Diagnosing this is based on the appearance and the location of the skin, right? Only by looking a doctor can diagnose that, okay, this is this problem. And if you want to confirm, obviously you need to take a skin biopsy, but it's rarely needed. right? Then coming on to the most important thing for which you are here, treatment. Flaking and dryness can be treated with over-the-counter dandruff or medicated shampoos, right? You can use any dandruff shampoo, but you can take a prescription from the doctor also. Look for a product that says that on the label that it treats seborrheic dermatitis or dandruff, obviously. Such product contain high ingredients of something called as salicylic acid, coal tar, zinc, resorcin, ketoconazole, or selenium sulfide. So these all things can be present, either one of them can be there or a combination can be there in the dandruff shampoos. Use the shampoo according to the label or according to your doctor's advice. That is most important. For severe cases, your doctor or healthcare provider will prescribe a shampoo or a cream or ointment or lotion which contains strong doses of these above mentioned medications, or they can actually have certain other medications like cyclopirox or sodium sulfacetamide, or even a corticosteroid or some tacrolimus or pimecrolimus. Like these are immunosuppressive medications. Sometimes phototherapy can be tried as a medical procedure on your skin, which is basically carefully exposed to ultraviolet light. That can be done by a dermatologist. Sun rays may also improve seborrheic dermatitis, but that is in some people. And you need to understand that seborrheic dermatitis is basically a chronic condition. Sometimes it comes and goes, but it can be controlled with treatment. Okay, severe cases of this problem can be lessened by controlling the risk factors and paying close attention to the skin type by discussing your options with your dermatologist. There can be certain complications of this condition like psychological distress, low self-esteem, sometimes people are embarrassed, and secondary infection can also happen because of bacteria or fungus. So that's the basic thing which you need to understand. Then talking about some tips for management, right? If you have a infant with a cradle cap, then you need to understand that this problem usually goes away within 6 months to 12 months of age. And if what you can do, obviously you can use a baby shampoo, a comb or brush. And how you can just shampoo the baby's scalp with a baby shampoo. It often helps soften the scalp. Then once the scale starts to soften, then you gently brush it away, right? Then you also need to understand that you need to take care of the diaper areas as well, right? If there is a problem in that area, you can talk to a doctor for a rash cream and other types of ointments or something like that. If adult have this problem in the scalp, dandruff shampoo needs to be used, and always read the label. Sometimes you might need to leave the shampoo on the scalp for a few minutes. So how to use it? On day 1, when you're using it, use the dandruff shampoo and continue using it every other day. On day 2, use your regular shampoo. Use this every other day. So one day you take the anti-dandruff, other day you use regular shampoo. As the problem of dandruff lessens, you can decrease how often you are using your dandruff shampoo, but use it at least once or twice in a week. So that's the idea. If you're not getting relief, obviously, as I said, all the anti-dandruff shampoo or higher concentration shampoos can be taken from your doctor. Hope this video was useful, and don't experiment on yourself. If there is a problem which is not going away, talk to a dermatologist. That's the best advice which I can give. And stay connected, guys. I'm Dr. Paramjeet. For such informative videos, subscribe and hit the bell icon of my channel. And don't forget to share this video with your friends and family and your colleagues. So till next time, I'm Dr. Paramjeet. I'm a consultant physician and cardiologist in Yashoda Super Speciality Hospital, Nehru Nagar, Delhi NCR. Stay connected, stay healthy.